So, and I don't have any makeup on today, so, but I still look cute because I got my lashes done and I put on a little gloss for y'all, so don't hate. Sorry. Anyway, back to the video. Hey y'all, welcome back to my channel. It's your girl Ebony, where we're all things nursing, cooking, and lifestyle. If you're new to my channel, hey boo hey. And if you like this video or any of my other videos, please don't hesitate to subscribe, like, and tell a friend. So as you can tell by the title, you already know what this video is going to be about: how to get through med-surg in nursing school. I am in my second semester out of 3, and we just started our last med-surg yesterday. So we had 4 med-surg classes. So just a disclaimer, every school is different. So how my school does it may be different from another school that's right up the street. My school may be different than a different state. So this is just my experience. So if you're starting LPN school or BSN, whatever, the way I'm doing mine may be different from yours. But regardless of how the schedule is, med-surg is med-surg. And I'm just going to tell you a few tips that I have done and am doing in my last med-surg course to get me good grades in med-surg. So before we even get on into study tips or tricks that I did for med-surg, you kind of just need to know what med-surg is all about. So basically, med-surg is when you get into your disease processes and basically what those disease processes look like on your patients and how you're going to take care of your patients. So in nursing school, it's all about how you're treating the patient, not necessarily the disease. Of course, you're going to learn about medications that are given to treat or to cure, sometimes not cure, but also just kind of lessen symptoms. You're going to learn about medications, but really the focus is how to take care of your patient. So you just need to know that's what you're going into. You're gonna be learning about all the types of diseases, and that's what it's really about: the disease process, and then what it looks like on your patient and how you're going to take care of that patient. So if I'm not mistaken, I can't talk, bro, what the heck? If I'm not mistaken, I believe most nursing schools require you to have A&P. So A&P is so important if you're taking anatomy and physiology now, or if you're about to take it or whatever, or if you've already taken it. Make sure you have a good foundation in that, because it's going to come back in nursing school. Like, your core classes are going to come back times 10 when you're in nursing school. So please take those courses seriously, not just to get good grades to get into nursing school, but really make sure you understand the information, especially in A&P. In your science courses, because when you get into diseases in med-surg, usually the first chapter is going to be like a breakdown kind of review of the A&P. So you really don't want to spend too much time on that, because most of the time you're gonna have 10, 15, 20 diseases that you're studying for. So you really want to have a lock on the A&P. If you need to go back and review, I don't suggest like going back into your A&P books, but just that first little chapter in your nursing school book will give you like a good description, like, oh yeah, I remember learning that. But it's very important that you have a good foundation so that you don't have to spend so much time learning that on top of learning the diseases. So for my nursing school, we had 4 med-surg classes, and they were just called med-surg 1, med-surg 2, 3, and 4. So the first med-surg was in our first semester, and our semesters are divided in terms. So like the first semester we had 2 terms. So the first half was fundamentals in pharmacology and lab, and then the second was med-surg 1 with clinical. So you had to pass the first to get to the second. Now we're in our second term. It was divided into 3 med-surges. So we got through med-surg 2, got done with med-surg 3, and now we're in med-surg 4, and that's going to finish out the semester in May before we start summer semester. So basically they're consecutive. They don't really coincide with each other, because med-surg is basically how we're doing it is broken up into body systems. So I can't really remember, but just say like your first med-surg, it might be cardio, musculoskeletal, and integumentary. or something like that. Then you finish that, and then you go into medsurg 2, where we're talking about respiratory, endocrine, and I don't know, reproductive or something like that. So it's like broken up. So you're going to hit each of the body systems, and so within those body systems you're learning about those diseases, those most common diseases, especially that's going to be on the NCLEX. So you're not learning all of the diseases like probably doctors do, but just mainly those high ones that you're going to see most often, basically. So, and I don't have any makeup on today, so, but I still look cute because I got my lashes done and I put on a little gloss for y'all, so don't hate. Sorry. Anyway, back to the video. So I'm gonna tell you guys how I conquered medsurg. So let me just put y'all back when I was in the RN program. That's when I failed out when we got to medsurg. I had passed fundamentals and I don't remember the other class, but medsurg is when I did not pass. So this time around in the LPN program, I was determined like I'm gonna have to figure out how to study, because I have to know these diseases and know how to treat my patient. It's very, very important. So I had to come up with like some type of way, because I'm determined not to fail type thing. So I'm gonna tell you guys how I did it. So basically, like I was telling y'all, the first chapter of the body system, whatever you're talking about, let's just talk about cardio, because I love cardio. It was so interesting. It's a lot to learn, but it's so interesting. So when you're starting cardio, it's going to be, the first chapter is going to be just a basic breakdown about the heart and the chambers and the atrias and the blah blah blah, the ventricles, and how the blood flows through the heart. So all that stuff that you've already learned in A&P basically, but you really need to know how it works, so that when you get to the disease, you're like, oh, that's, so if the person has this, this is why they have these signs and symptoms, because this is affected. So that's why I'm saying it's really important to know your A&P. So basically I just skimmed through the A&P because I have a good I have a pretty good ground on A&P. If you do not, make sure you really study that, but you need to do it promptly, because like I said, you're gonna have several diseases that you're gonna have to know, symptoms, meds, diagnosis, how they, you know, test to see if this person has this disease. So you're gonna have to get through that A&P quick. So make sure you go through that, and then so after I get a skim through that in the book, then I will go through the diseases that my teachers will hit in class. Okay, so boom, you went through the A&P. Now you're getting into your first disease. Okay, so I'll write the disease down. Let me see, we're talking about cardio, so let me talk about, let me see what I'm gonna talk about. Left-sided heart failure, that's really common. Okay, so left-sided heart failure, what is that? Like, I'm going to write down the definition of that. It's basically when the left side of your heart is not pumping efficiently, okay? So write that in my own words, or I may write the definition in the book, but whatever I write down, I understand it. I'm not just writing stuff down, okay? So you make sure you put a definition in that you can understand, whether it's word for word in the book that you understand, or you write it in your own words. So I'm writing it down, okay? So sometimes it's important to know the cause of the disease, sometimes not so much. So if your teacher specifies you need to know what causes this, make sure you write it down. So cause, left-sided heart failure, blah, 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 right? All right, y'all, so I had to put on my glasses because I could not see. I didn't have my contacts on. I just didn't want this reflection, but it's okay. So let's go back to the left-sided heart failure. So when we take that disease, we're going to go back to A&P and think about what the left side of the heart does, which we know from A&P that it receives the oxygenated blood, right? So that our blood can have the oxygen, that nutrients that it needs, so that we can breathe and do all the things that the oxygen does for our body, right? So we have disease that is not doing that. Do you think that we are getting the oxygen that we need with our lungs and everything else? Probably not, right? So then that automatically tells you what the side effects are going to be. So you have to know what it's supposed to do, whatever disease you're talking about, what it's supposed to do, and then what this disease is causing it to do, and then therefore the effects of the disease, okay? So like I said, the causes sometimes are relevant, sometimes not. So for this, I'm just going to get right on to the next thing that I would do is write down the signs and symptoms. So what does my patient look like when they come into the hospital or they call 911 and say they are having these signs and symptoms? You should know, oh, boom, they might have something going on with their heart. You may not know exactly what it is, but these signs and symptoms are going to tell you a little bit or try to decipher what it is that they may have going on. And we know that nurses do not diagnose. So it is not our job to say, oh, that's left-sided heart failure. But for our test, we have to be able to decipher what disease is what so that we can know how to take care of the patient. So for test purposes, you have to know these diseases. But like in your practice, you're not going to be diagnosing patients like, oh, they have left-sided heart failure, okay? So, but you need to know for your test. So for signs and symptoms, we go back to A&P, what the left side of the heart does. We already know what it does. So if we're not getting the oxygen that we need for our lungs to breathe, we're going to have lung or breathing issues, okay? We're going to see chest pain. We're going to see irregular heartbeat, dysrhythmias, shortness of breath, anything pertaining to the lungs and breathing, you're going to probably see with your left-sided heart patients or left-sided heart failure patients, because like we said, it's dealing with the oxygen. We're not getting the oxygen in our blood, so we're going to have some breathing issues. So those are very important to know, your signs and symptoms. I personally, when I'm studying, I'm not going to write down vomiting, nausea, diarrhea, unless it's like projectile vomiting or severe diarrhea or bloody stools, like something that like stands out. But headache, nausea, vomiting, those are pretty vague symptoms. So to kind of cut down on studying time, I mean, most of the time those symptoms are pretty vague. So I personally just write down the ones that are for sure going to be a good representation of, yeah, this patient probably has left-sided heart failure, okay? I'm not going to put just vague symptoms because that's not going to really help you on the test. Now you can remember the vague symptoms, but really just focus on the ones that really are that stick to this disease, that are only with this, maybe not only with this disease, but it's going to be different from right-sided, okay? Does that make sense? I hope that makes sense. So basically pull out the most pertinent information. That's what I always do. Pull out the most pertinent information, not everything. We're not writing the whole book down. I mean, we already got the book while we're writing it down, okay? All right, so after you get your most important signs and symptoms, you're going to go into how you're going to how would the doctor, or what would the doctor order for diagnosing left-sided heart failure. So sometimes these are important to differentiate, especially with cardiac, because we have so many different tests that they do. So I would just go over those. If they say it in the book, just write a couple down and then you should be good. I'm not gonna really spend too much time over that because simply it's pretty simple. So either they may have 3 or 4 that they may test, the doctor or the provider may test to see if this person has this disease, and you just need to really basically be familiar with them just so that you can differentiate. Because if you have a question that asks what test would the provider order for, you know, trying to see if this person has left-sided heart disease, you kind of need to know the difference between all the different cardiac tests. So just know your test basically, okay? So after you got the diagnosis, kind of the testing or whatever, then you're going to go to how do you treat the patient. So that's going to be your medication, that's going to be your care for the patient, teaching for the patient, just things of that sort. So what are you going to do as the nurse to take care of this person who has left-sided heart failure? So we know that they have chest pain, so we're going to need some medication, right? We're going to need probably some heart meds, right, to keep their heart rate from going too high or too low. We're going to try to keep them sitting up, because if they're laying down, they're already having trouble breathing. Is that going to help them? So we're going to probably keep the head elevated, just like things like that. We're going to make sure that we know, okay? So for these exams, it's very important that you pull out the most pertinent information, like what sticks out to me about this disease that no other disease has, or most diseases don't have. Okay, so left-sided heart failure, left lung, that's how I always remember. So if they have left-sided heart failure, they're gonna have some lung breathing issues. That's how I always remember that. So then I just know the signs and symptoms of breathing issues, shortness of breath, chest pain, angina, which is severe chest pain. Like those symptoms I know for sure because it's going to be on the test. Like the most important thing is going to be on the test. So that's what you need to know. So I talked about like how you're caring for the patient. You're going to raise the head of the bed up. You're probably going to tell them to do some deep breathing exercises. Just things to kind of help them breathe a little bit better. Meds, you're going to have to know. The book will tell you several meds. The best way I can just tell you is you're just going to have to know the meds. I mean, you're just going to have to study, basically. But you're going to have to know the meds that go with these different diseases. So that's all I can really say about the meds. Teaching when they go home, what are you going to tell them? Don't be laying down, you know, stay elevated. Call immediately if you have some angina that's not relieved, things of that sort, that you have to call your provider immediately. Those like just dangerous things that, okay, if you have this, call the doctor immediately. Things of that sort. So like I said, it's really pulling out that basic information, but this is the guideline that I'm giving you. Like if you do this for every disease, you're gonna be straight. If you pull out the most important information, because we just need to know a well-rounded information. We just need to know a well-rounded amount of information about this disease so that we can take care of the patient. So really what's heavily tested on is the signs and symptoms, like what does the patient look like, and also what are you going to do for the patient. Okay, those are usually your questions. And of course meds. So like I said, meds, you just gonna have to know meds. So yeah, so after you do your teaching, then that's it. So you started with what the disease is, you went back in A&P, you broke down what it's supposed to do and what's happening with this certain disease. Then if you need the cause, then you write down the cause. Then you go into your signs and symptoms, the most important signs and symptoms, not all 20,000 of them, because there's going to be 20,000 of them. Only 5, 6 you may need to know. Keep it pushing. After you know the signs and symptoms, you go into what the doctor or the provider may order for diagnostic testing to make sure that this is the correct disease. Just know those so that you can differentiate between them. After you do that, you're going to do what am I going to do for this patient. So that's including medication, care that you're going to do as a nurse, and teaching when you get home. So, or teaching when the patient gets home, so that when they go home, they're able to continue the care that they had at the hospital. Because if they go home, they don't know what to do, because you've been really doing it at the hospital or wherever the setting is. Then they may be in the same predicament. They may be back at the hospital. So you're teaching them so that they can take care of themselves, or at least try to when they get home or wherever they're going. So that's really basically all that I have done for medsurg to get me through. I feel like this method has given me, like, I understand the diseases. It's not like I'm trying to just memorize everything like I had tried to in the past. It's too much information to memorize. You really have to understand. Go back to A&P. That's basically what it is. You're gonna have to know your A&P to get through medsurg, or at least make it easier for yourself. If you already kind of know, like, yeah, I know how the blood flows and what the left side of the heart does, the right side of the heart does, whatever the disease you're talking about, whatever body system you're talking about, that's what's going to help you. So I hope that helps. If you guys have any questions, I hope I didn't miss anything. That's just what I do personally. But if you have any questions, please leave them in the comment section. I'll be sure to answer them if I haven't already answered them in this video. You can also comment what you guys want to see next, and I hope to see y'all in my next video.